Good morning. My name is Hian Tran. Today, I would like to have a short presentation for the education innovation project that I will implement for the newly hired nurses and new graduate nurses in the hospital in North Carolina. With my own experience, as I often present for newly hired nurses and graduate nurses, and after conducting a short survey with 5 questions related to sepsis management and the using of sepsis screening tool, including the modified early warning score (MEW score) in sepsis recognition and intervention, and literature reviews, I got a significant result that indicated that among newly hired nurses and new graduate nurses may experience a knowledge gap in sepsis management and using the MEWS system, or lack of self-confidence in patient care for suspected sepsis patients. As we know, early recognition of sepsis and intervention of clinical deterioration still remain one of the most significant challenges in adult medical surgical patients that leads to poor patient outcomes, significant complications, extended hospital stay, increased healthcare costs, and even mortality. The modified early warning score (MEW score) system is being used to identify patients at risk of clinical deterioration, including those with sepsis. The MEW system is an effective tool for healthcare providers in supporting the early recognition and intervention in sepsis patients and highest accuracy preventing clinical deterioration. A survey with 5 questions related to sepsis management and using the MEWS system in sepsis recognition and intervention was conducted in the hospital in North Carolina with 10 participants who are newly hired nurses, experienced nurses, and new graduate nurses uh, transition from academy setting to practical settings. Um, at a medical surgical unit, the result of the survey indicate an educational need to address sepsis knowledge gap and the failure of using the modified early warning score among these target learners. The qualitative data was collected and analyzed with the result of 80% of experience knowledge gap among about using MEW score as an effective tool in sepsis recognition and intervention to prevent clinical deterioration, and 100% experience lack of self-confidence in patient for sepsis patients. The intended outcome of this innovation is addressing knowledge gap and increasing the confidence level of sepsis management among newly hired nurses and new graduate nurses to improve nurse knowledge and their co- com- competencies of early recognition and manage patients with sepsis. The early the education innovation will occur in the classroom with 10 participants, newly hired nurses and new graduate nurses who will work for medical surgical unit. The course will be 1 hour in-class setting for target learner to engage in active learning process to build up new knowledge by participating in lecture presentation with PowerPoint presentation related to sepsis management and the use of Muse tool in sepsis recognition and intervention in the hospital setting. Prior to attending to this education section, target learner will receive a link or a QR scan code for handout with vital information related to education course and access the online article about sepsis, sepsis screening tool, and sepsis recognition in specific population and patient care for sepsis patient in hospital. Factual knowledge will be provided through a PowerPoint presentation and will be supplemented with the media sources like a YouTube video, which offer the alternative of visual and audio information for learner to achieve in-depth content overview of selected of this course. Constructivism learning theory will be the guiding educational theory for this education innovation project. Constructivism theory posits that learners engage in an active learning process to build up knowledge of the selected topic through their existing knowledge and experience. Learners of this education project are newly hired nurses and new graduate nurses, so they have a different in their nursing background experience, and they have their own knowledge about the sepsis management and the use of sepsis screening tool, including the modified early warning score tool. By actively engaging in inquiry-based learning, group work, discussions, hand-on activities, and the factual knowledge from PowerPoint presentation in classroom and media sources like YouTube, learners are able to connect new information with their existing knowledge and experience. The assessment and evaluation plan for this education innovation project will be the rubric included specific criteria such as expectation for participation, quality of contribution, and collaborative behavior when learners participate in group discussion with exercise question and patient situation or scenario. Positive feedback will be provided, and it helps individuals recognize their strengths while also identify areas that they need to be improved in a supportive environment. A post-test will be provided at the end of the course with the 10 questions, and learners have to achieve 8 over 10, like 80% correct answer to pass this class. The utilize of learner pre-test and post-test score after implementing this class will help to evaluate whether or not learner meet or learning outcome as their knowledge and their confidence level in caring for patients in sepsis, as well as an increase in knowledge will gain for the majority of learners. The end of course surveys with 5 questions also be conducted after the class to measure student learning outcomes and lead to develop a continuous improvement plan for the education project. After implementing this education section in the classroom, peer review feedback from preceptor and clinical nurse educators will be conducted as well to evaluate if this course intended learning outcome was met and foster continuous improvement plan and innovative strategy, and ensure that the selecting teaching strategy remain relevant and effective in meeting educational goals. It's vital to regularly monitor Muse recognition protocol and update to ensure the class content is up to date